Welcome to the first webinar of 2022 for the Lupus Society of Illinois. And it is Lupus and COVID-19, vaccines, boosters, and treatments. And it's a public health presentation. We're going to get started in just a minute. A little bit of business for today. The public health presentation, we are not going to take live questions. All of the questions were requested prior. I did want to review about today's presentation. This event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status. This event is being recorded and will be archived on the Lupus Society of Illinois' website. So Karen Mancera-Cuevas, PhD, is the Deputy Director of Health Promotion at the Illinois Department of Public Health. Her professional background includes working in academic centers emphasizing clinical public health and community-based participatory research at the University of Illinois at Chicago and Northwestern University. She's also worked in local nonprofit and policy level settings. Programs developed under her leadership addressed chronic disease health disparities in diverse communities of color, specifically targeting women and children at the community level. Dr. Mancera-Cuevas has over a decade of experience in lupus education and research. She's advocated for lupus awareness and has presented on lupus-related issues many times for the LSI over the years. Now, without any further ado, Karen, I will pass it over to you. Okay, great.
Okay. So as I previously said, our presentation today will focus on lupus and the COVID-19 vaccine, boosters, and treatment. So this will really be entirely from the public health perspective. And please consult with your rheumatologist or primary care provider about either treating your lupus or loved one's lupus symptoms. So please go on to the next slide, please. Okay, so reviewing the public health definition, and I really wanted to review this overview because particularly with the pandemic recently, there's been a new understanding as to what public health is. And, public health in itself is, the science of protecting, and improving lives of individuals and communities. And I think that really has been foundational in terms of understanding where we lay with COVID. And a lot of it's related to just promoting healthy lifestyle. So it's a lot of primary prevention, a lot of disease and injury prevention, and then the response to the detection, prevention, and response of infectious diseases. And one of the most important infectious diseases today has been COVID-19. So if you can move on to the next slide. So lupus and COVID-19, I just really wanted to emphasize it's important that you emphasize to anyone that come in contact that lupus puts you at higher risk from infections, including COVID-19. And I think that this is implicit for individuals with lupus because of the issues of immunocompromise in their system. And this is just kind of rules of thumb, as well as if you come in contact with someone who is positive for COVID-19, to please follow the CDC guidelines and local health department recommendations for self-reporting and quarantining. Lupus is a chronic autoimmune disease, and this can make the immune system less effective at fighting infections. And I think that that's, the really important nuance of lupus and COVID-19 versus the general public who do not have to face, these types of realities. So please go on to the next slide. So at-risk groups. So it's really important to understand that adults of any age with the following conditions are at increased risk of severe illness from the virus that causes COVID-19. And that includes conditions such as the variety of cancers that exist, chronic kidney disease, and I say chronic kidney disease, not end-stage renal disease, which is common in individuals with lupus, but chronic kidney disease, chronic obstructive pulmonary disease, COPD, Down syndrome, a variety of heart conditions. Heart conditions are very common in the US population, and it's really due to sedentary lifestyle and diet, and that includes heart failure, coronary artery disease, cardiomyopathies, an immunocompromised state, which one could consider is inclusive of lupus, weakened immune system, and not just from a solid organ transplant, but also the realities of the immunocompromise as a result of lupus. Obesity with BMIs of 30 or higher, severe obesity, so individuals who are severe obese for a variety of reasons. Pregnancy, although it is a temporary state, it also puts the individual in an at-risk group. Sickle cell disease, very important, particularly in Black and African American populations, is, really significant, particularly in our state. Individuals who smoke, and those who have type 2 diabetes. So these are all at-risk groups. So can you please move on to the next slide? So COVID-19 variants, viruses constantly change through mutation. So, and new variants of virus are expected to occur over time. And so, we've seen this in instances with Delta and Omicron, where originally there was one form of COVID. Then we started understanding about different types of variants, how they emerge, how they disappear. Others may persist, and really kind of understand the analogy of variants, very similar to the analogy of flu variants, which there may be a different type of variation of the flu in any given year. The same thing really played out the same way for COVID-19, where there was just a variety of different ebbs and flows, whether it be Delta or Omicron, and most recently Omicron, we're hitting at the bottom end of that curve. So next slide, please. COVID treatment. So I really wanted to hit the point about remdesivir for adults and certain pediatric patients with COVID. So this is for COVID treatment, and I really want to preface this in the general population, not necessarily with individuals with lupus, but it's really important to understand in the general population, first line of action would be remdesivir. The FDA, because of that, and because it is a public health emergency, can then authorize the use of unapproved drugs or approved drugs used for certain conditions. And as we're going to talk later in this talk, some of those conditions has been lupus, that biologics have been used as monoclonal antibodies for those conditions. But in this case, for the general population, a lot of these COVID treatments were used under the EUA. And federal EUAs, which is the emergency use authorization, is used for several monoclonal antibody treatments for COVID-19, and in some cases prophylaxis of COVID-19 in adults and pediatric patients. It's also important to know that monoclonal antibodies are laboratory-made molecules that are a substitute to antibodies. So that's a real important concept to understand, particularly when individuals need to understand about treatment and how COVID propagates itself in individuals' immune systems. It can help your immune system recognize and respond more effectively to the virus, because how it is made up in terms of that molecular state, and making it more difficult for the virus to reproduce and cause harm. So that, at the end of the day, is the importance of the COVID treatment, is really to subsidize harm in the body of the individual. So if you could please go to the next slide. Thank you. Vaccines. Vaccines work by mimicking the infectious bacteria or viruses that cause disease. So this is vaccines across the board. We're not necessarily talking about specifically the COVID vaccine, but that really is the development of vaccines. And as we know, individuals with lupus, they're going to be in a situation where you have to work case by case to see, will that vaccine interact with lupus care and treatment? Will it cause damage or organ failure. So a lot of these facts are just to understand the concept of vaccine, not your individual situation, but really the intentionality of what they're supposed to do in terms of purpose. So vaccines also stimulate the body's immune system. So we can go back for a second. To build up defenses, they act as parts of the infectious organism that the immune system recognizes as a foreign body. So, and that's particularly important when it comes to antigens. And the vaccine intentionally then exposes the body to these antigens. So this is really significant in terms of how the autoimmune system reacts and why the vaccines are protected for the individual in a general population. So move on, please. All right, to the next slide. Vaccine safety. So we have had a significant jump. I had looked at my presentation more than a year ago, and at that time we only had 5 million doses, and now we have more than 553 million doses. So truly there has been a nationwide ramp up, and there's not 553 million people, so that's important to know. There's 300 plus million individuals in the US with a generic, understanding that there's a sequelae of a certain amount of doses, 2 doses and then the booster. That's not necessarily the rule for individuals with lupus, but considering that that's the dose frequency will generally be about that rate. COVID vaccines are safe and effective. They've been evaluated in tens of thousands of participants in clinical trials. A lot of questions sometimes are, have those clinical trials included individuals with lupus? Most likely that there were not as many individuals with lupus, generally because they're looking at stratified samples, individuals who don't have a lot of existing conditions, just because if there's any adverse events which occur in any clinical study, including lupus clinical trials, you want to see, before and after with the individual. Millions of people in the United States have received the COVID-19 vaccines, and these vaccines will undergo the most intensive safety monitoring in US history. Please move on to the next slide. So how do vaccines work? So, so these COVID vaccines particularly help our bodies develop the immunity to the virus that causes COVID without us having to get the illness. So that's really important. So different types of vaccines work in different ways. So with all types of vaccines, the body is left with memory T lymphocytes, as well as B lymphocytes that will help the body itself remember how to fight the virus in the future. So once that's in the body recognizes that. And it generally takes a couple of weeks for the body to produce T lymphocytes and B lymphocytes after the vaccination. But it is possible that a person could get infected with the virus that causes COVID-19 before or after the vaccination, get sick, and it's oftentimes that window period when the vaccine hasn't had time to really provide enough uptake within the biologic system. So that's really the premise of the COVID vaccines. Now, many people ask, well, I got the COVID vaccine, but I ended up getting Omicron. That can happen. Again, individuals who have the flu vaccine can get influenza. So, those are just, when we talk about approximations of the variants, when the vaccine was developed for the COVID, it was not considering that particular variant at the time. It was considering likely the prior variant. So a lot of these considerations, but at the end of the day, the vaccine provides more protection for the individual than if they were not vaccinated. And obviously with individuals with lupus, that's a conversation to have with a primary provider, with the rheumatologist, depending on treatment. But if everything is going to play out in a significant way for the well-being of that individual, the provider may make, in conjunction with the patient, the decision that's going to best protect their patient against COVID-19. So please go on to the next slide. So types of vaccines. So currently 3 vaccines authorized and recommended to prevent against COVID. The first is the Pfizer BioNTech. So 21 days between shots, the Moderna COVID-19, 28 days between shots, and then the Johnson & Johnson COVID-19. So Pfizer and Moderna are recommended by the ACR. The ACR is the American College of Rheumatology for individuals with lupus. So the recommendation is, if you are an individual with lupus and are moderately to severely immunocompromised, that means at this point you may need 4 doses of an mRNA vaccine, or 1 dose of the Johnson & Johnson. mRNAs are going to be the Pfizer and Moderna. If you are getting the 1 dose of the Johnson & Johnson, you will also then need 2 doses of an mRNA vaccine to receive the best possible protection against COVID-19. So the formula is going to be a bit different than in the general population. And it really is due to the guidelines that the American College of Rheumatology has recommended for individuals with lupus. So if you could please move on to the next slide, Mary. COVID boosters. So COVID boosters, everyone ages 18 and older should get a COVID booster, at least 5 months after the last dose in the primary series. And teens 12 to 17 should get the Pfizer vaccine booster 5 months after their last dose. So this is general population information. This is COVID boosters for what you would see in the general population. And in addition to that, Moderna is encouraged for everyone ages 18 and older. And they should also get the COVID booster shot after either Pfizer or 5 months after the last dose in primary series, and with the J&J, Johnson & Johnson Janssen, individuals get a COVID booster shot after of either the Pfizer or Moderna at least 2 months after the first dose of J&J. So guidelines are very different. Again, I wanted to provide that comparison against the general population so you're aware of why the guidelines for individuals with lupus are different. Again, ACR guidelines for the general population is considering general population well-being and health of those individuals. So that's why these are very generic statements when it comes to guidelines for the general public. So if we can move on to the next slide. Vaccines and lupus treatment. Some lupus medications affect how the COVID vaccine works, and there's a lot of literature to support that. American College of Rheumatology has, different drug classes and different interactions and recommendations, and those conversations need to be made in conjunction with the rheumatologist. So the rheumatologist is going to know what the American College of Rheumatology recommendation is, and is going to be able to appropriately follow within that drug class how they should be working in terms of either, addressing COVID-19 vaccination hesitancy, or monitoring once their patient has the COVID-19 and how that works. So really, really important. So in some cases, particularly for those who take immunosuppressant drugs, your doctor may have special instructions for you so you can get the greatest possible benefit from the vaccine. So they may decide to modify, they may decide to adjust, they may decide to keep things the same. Again, no 2 lupus patients are the same. No 2 individuals with lupus have the same concerns. No 2 lupus patients have the same medical history or have, organ-related challenges or have to see specialists. So really that has to be very intricately designed in conjunction with their physician. Your doctor can also recommend that you continue to wear a mask or social distance. So right now we have the masking guidance has changed in Illinois. And it may be that you as an individual may decide, I would rather wear a mask. Again, masks at this point in time are completely elective, but an individual with lupus or a similar immunocompromised condition may want to, move forward with, continuing to wear a mask. And again, you must really check with your doctor about how the COVID-19 fits into your treatment plan. So that has to really be a fluid conversation. Right now, we are hopefully at the last of our largest peak in Omicron, and we won't be seeing significant jumps in terms of COVID, but one never knows. And so I think that, generally rheumatologists are trying to be as protective and preventive with their patients as much as possible in order to avoid any flares or any relapses. As we know, flares can be common with individuals with lupus and triggered in a very unpredictable way. So I think working with rheumatologists is really the best way to move forward with the treatment plan. So please go on to the next slide. So vaccine efficacy for individuals with lupus, the American College of Rheumatology clinical guidance recommends that people with autoimmune and inflammatory rheumatic disease that includes lupus get the vaccine unless they have an allergy to an ingredient in the vaccine. Again, this is not to replace your rheumatologist guidance, but this is really just mentioning the guidance that's provided through the American College of Rheumatology. And for some people who cannot stop their strong immunosuppressive medications, the FDA has issued an emergency use authorization for a medicine called Evusheld that can prevent COVID-19 for up to 6 months in people who have not been exposed to the virus. So again, this would be with certainty that you haven't been exposed to the virus, and there may have to be some lab tests in order to determine if this is the case. The drug is recommended for certain adults and children who are 12 years old and weigh at least 88 pounds. So these are considerations that are out there. Again, very prescriptive according to working with a physician. Evusheld is only for people who have moderately to or severely immunocompromised due to illness or medications, or have a history of allergic reactions to the ingredients in COVID-19 vaccines. Evusheld consists of 2 injections and can only be prescribed by a doctor. Moving on to the next slide. After vaccination, what are the common side effects? So common side effects include pain, swelling in the arm, throughout your body, fevers, chills, tiredness, headache. Side effects include ability to do daily activities, but you go away in a few days. Important to mention side effects because it may be that you have a sense of fatigue as part of your lupus, and the fatigue may be accelerated because of the vaccine. So if you experience some of these indications or symptoms as part of an ongoing regular lupus symptomatology, it may be a bit exacerbated because of the vaccine. Please go on to the next slide. Vaccine access. Vaccine access is really now plentiful. A year ago, it was very difficult to access vaccines. And since then, vaccine manufacturers, the federal government, the state government, you see many places that are community-based testing sites, pharmacies, community-based partners. So in many localities, there is ability to access a vaccine to make sure there's safe and effective vaccines to get you access as quickly as possible. And I have included a link through the state of Illinois that has a map of the entire state, wherever, whenever that, if you choose to elect to get vaccinated, there is a locality for you to do that. So please go on to the next slide. So the reasons for vaccination are really important. Getting vaccinated is one of the many steps you can take to protect yourself and others from COVID-19. I think that really has been something that has resonated for a lot of people in the public to move in the direction of vaccination. There's also protection from COVID-19 is critically important because for some people it can cause severe illness or death. And that is particularly, important for individuals who are not only immunocompromised with lupus, but who have all of those other indications, as I said, groups that are, really, at risk. All of those individuals as well, individuals who have cardiac issues that do not have lupus are also at risk for illness, and as well as pulmonary issues. So that is a consideration for many to move forward with a decision. Vaccines work with your immune system, so your body will be ready to fight the virus if you are exposed. So please move on to the next slide. I've listed here 2 links with more COVID-19 information. So I really hope that that will be an informative resource, and also, you know, plentiful of facts and information to learn more. And these are the references, many from CDC, FDA, Illinois Department of Public Health, for your further information on the topic. And the last slide is that is it. So any questions? Thanks for listening. I hope you enjoyed the presentation. That doesn't necessarily cover Lupus 101, which I know many of you are very, very proficient on, but talks more about the treatments and the vaccines and where we're at today. So Mary, do we wanna move on to the question and answers?
Yeah, I think so. I was a pretty great clicker. I wish I was as handsome as this dog here, but I'm not. That was me trying to be funny. So should we put our cameras on for the questions? And these are pre-questions, pre-event questions that we put together, and I can just go through that list. Does that work for you?
Yes.
Okay.
Back to the Go To tab.
On and put so we can see some faces. You want to share your camera too?
Mm-hmm. So I'm right. Do you see me?
You know what? Only because it's hiding.
Yeah, I'm just on camera. So.
Okay. Excellent. So question number 1, are vaccines effective against the COVID variants for both people with lupus and the general public?
So I would say yes. So far, studies suggest that antibodies generated through vaccination with currently authorized vaccines recognize these variants. And this is really being closely investigated, and more studies are underway.
Okay. All right, great. Can people with lupus get a COVID-19 vaccine? I know that this is the whole presentation, but I know that there's still confusion around this. So just to drive the point home again.
So everyone 5 years of age and older. So again, we just went to 5. So I mean, in the general population is now eligible to get the Pfizer vaccine. And the Moderna and Johnson & Johnson are available for persons age 18 and above. So really that's the distinction. The distinction is that the population is getting younger in order for us to be able to protect those individuals in that group, and particularly for minors, for parents to make a decision, a cost-benefit decision about vaccination, but to make that available, right? So that's what's kind of changed in the last couple of months.
Yeah. All right, great. Next question. Which vaccine is the most effective for people with lupus?
So currently all 3 that are currently vaccinated or approved vaccines are highly effective to protect against severe illness. And that includes among individuals infected after being vaccinated. So right now, most cases of COVID-19 are in people who are not fully vaccinated, and that's really important to distinguish. So although COVID-19 vaccines currently appear to be very effective against severe disease and death, no vaccine is perfect.
Okay. Another question I think you kind of reviewed during the presentation. Can people with lupus get COVID-19 from the vaccine?
So absolutely they cannot. None of the COVID-19 vaccines contain the live virus that causes COVID-19, but this means that the COVID-19 vaccine cannot make you sick with COVID-19. Okay.
Is it possible to compare the effectiveness of the 3 COVID-19 vaccines?
So the answer to that is no. The only way to accurately compare the effectiveness of vaccines is by direct comparison in head-to-head clinical trials. So that means comparative trials, which did not occur on these vaccines. Additionally, the clinical trials for these vaccines occurred in different geographic regions and at different points in time without varying incidence of COVID-19.
Okay. How long before the vaccine provides immunity?
So typically, as I indicated, a week or two for your body to build protection after vaccination, but that means it's possible for a person that they could be infected with the virus that causes COVID-19 just before or after vaccination and still get sick. So like that window period is critical in terms of masking and hand washing, et cetera. And this is really because the vaccine has had enough time to protect, to provide protection. So making sure that you're protected within those windows, particularly in the initial part of the COVID vaccine vaccination series, is really important.
Okay. This is kind of the same question asked a different way. Are COVID-19 vaccines safe for people with lupus? And I'm even like if they're in a flare perhaps, or just people with lupus. I know that it's hard to answer.
You know, so they are, I mean, as I said, there have been rigorous studies. The FDA granted approval, and it's mostly because of the safety criteria and the determination of data. So the data and the science really guided the findings in terms of study outcomes. So, you know, like, I think the difference here is that this is really maybe looking in terms of like, you know, oversight at the federal level to see like, was everything done and were all of the rules and guidelines followed? And in fact, that did happen.
Okay. All right, great. So here's the question, do I have to get a COVID-19 vaccine?
So as I said, this is like completely voluntary. So there is no federal or state mandate for the general public to receive the COVID-19 vaccine, but the CDC recommends the vaccine to all Americans 5 and over. And it's just really due to its virulence, secondary effects, etc. So it's really encouraged. It's not mandated. There's no requirement. You should be, you know, not feel coerced or forced to do it, but the benefits in the larger society in terms of a public health practice really are being encouraged with the general population.
Okay, so encouraged, not required.
Encouraged, not required.
Okay, so next question. Will youth with high-risk conditions be included in any of the phases?
So everyone 5 years of age and older is now recommended to get a COVID-19 vaccine. And if you have questions about the vaccine, to talk to your healthcare provider for advice. Clinical trials in children younger than 5 years of age are ongoing to determine if the existing vaccines are safe and effective for them. So, you know, what I would say is that the clinical trials were with children. And considering, you know, like the exposures and risks that children have, not necessarily with the high riskness of their conditions.
Okay. What happens if I refuse to get vaccinated?
So there are actually no legal repercussions, no fines, no sanctions, no punishments for refusing the vaccine. If you don't get vaccinated, you will not be protected against the virus that causes COVID-19 and will be more likely to be infected with the virus. Additionally, you will be at risk of transmitting this virus to loved ones and other community members, which is really why we've really taken the stance of really making this more of a public health approach, because, you know, obviously we don't want individuals in the community to get sick. So still highly encouraged.
Excellent. Okay, so here's a good question. It took 4 years to develop the mumps vaccine. How could the COVID-19 vaccine be safe and thoroughly tested so quickly?
So there were just a lot of things that helped develop this vaccine so rapidly. And a lot of it was a lot of resources, a lot of investment in basic research and clinical trials that accelerated the timelines greatly. And, you know, those existing trials, you know, developed new sites, and then the virus had a good vaccination target and low mutation rate. So really different than other types of vaccines. Additionally, the amount of infection in the communities allowed scientists to compare vaccinated versus unvaccinated populations and then show how the vaccine worked in those populations. And there were just many volunteers who just wanted to try the novel vaccines during the clinical trial. So I think that that's the difference in between like mumps, or there's also chickenpox vaccine. I mean, a variety of vaccines out there that exist and may take years and years in order to, gather the data. But in this case, like we were really pressured against time. And because COVID, really exploded to such a severe degree, there had to really be a lot of scientific intervention in order to find vaccination quickly.
Right. I'm not sure you can answer this, but I'm going to ask it anyway. Is the as we progress scientifically and we create more vaccines, is that partly why it's becoming quicker to do it? Like, are we just getting more efficient in streamlining the process, do you think?
I think that it has to do with the type of vaccine and what you're really vaccinating against, right? So I think that those are really things to consider when you do vaccine development, that different types of vaccines are going to move at different paces. Number one, because if you have a highly prevalent population with it, and you know that it's very, very virulent, and you already know transmissibility, there's a lot more that you can do in terms of vaccine development than like what would be considered a little bit more rare diseases. It really depends on the biology at the molecular level of the condition that you're trying to treat. And that really can be a game changer. And I don't want individuals in this audience to confuse the rate of vaccination development with like lupus clinical trials. That's like a whole other conversation. I mean, I've given the talk before to the Lupus Society. One thing is one thing and another thing is another thing. So I just want to make sure that participants in the call distinguish that, because they're two totally different types of studies. Doing a study for like a vaccine is totally different than doing a study for treatment.
Yes. And if anyone has follow-up questions on that, please let me know, because we do have resources that we can refer you to. So that's a really good distinction. Okay, another question. Why have we not achieved herd immunity when the vaccine has been available for over a year? How many people need to get vaccinated to have herd immunity to COVID-19?
So the percentage of people who need to have protection to achieve herd immunity varies by disease, and scientists estimate that to control COVID and reach herd immunity, like 7 or 8 of every 10 people, so 75 to 80% of the people will need to be immune. And currently we don't have those vaccination rates in the United States, nor have we determined that people have antibodies at that rate. So herd immunity, in fact, has not been achieved thus far, even though we have 553 vaccinations, as I've indicated. But again, that considers some people had 3, some people had 4. And so you're counting per person, not counting per individual in that number. So we still have a ways to go to reach herd immunity, but I think that also we'll have to really see how these variants play out. And variants play out in different ways. So more to come on that.
Yeah, well, it's constantly evolving, I think, and this is an aside, but there was another one today, like a Deltacron or something, like a combo mutation, but I don't even want to, I should have even said it out loud.
Yeah.
Okay, well, that's interesting about herd immunity. Hopefully at some point we'll get there. What about vaccines received outside of the US? Are these vaccines safe, and are they safe for lupus patients?
So if you received all the recommended doses of a COVID-19 vaccine listed for emergency use by the World Health Organization, the WHO, you do not need additional doses of an FDA authorized COVID-19 vaccine. So again, this information is with those that have vaccines outside of the US. So if you've not received all the recommended doses of a WHO approved vaccine, you should complete an FDA authorized vaccine series. So, just keep that in mind. I mean, Most individuals who are getting treated within the U.S. follow U.S. guidelines, but I know that there are a couple of individuals who, have, connections outside of the United States and maybe going back and forth. Really is important to keep that standardization there in terms of really overall COVID protection.
Right. So I know you've been so busy with this. Illinois Department of Public Health has been, I'm sure, had quite the couple of years, right? It's almost exactly 2 years since the shutdown started. But the vaccines you were talking about, right? The Moderna, the Johnson & Johnson, and the Pfizer, those are all FDA approved, right? And the ones that are out of the country are not under FDA approval.
Not under FDA approval. So that's why we would really have to be a conversation, like with the provider and really being able to clarify what type of vaccine. Because I know in some countries they're using like Sinovac, which has also been used, but efficacy rates in terms of protection have been lower. And so like, let's say, for example, if you took Sinovac, then you may have to have a conversation with your provider and considering also lupus treatment, because then that's another layer of consideration. Like, would there be any drug interaction with this? Would there be any, like organ change if I were to take then this other sequelae? So it really, in a lot of ways, is a more intricate conversation because the physician needs to look at dosing, needs to look at side effects and those types of things. So a lot more considerations to keep in mind.
Yeah, it's times like this that you're really grateful we have an FDA and an Illinois Department of Public Health to really do all that heavy lifting. Those are all of the scripted questions. Is there anything else you'd like to leave us with or let us know?
Well, I think that there's just, like a lot out there in terms of misinformation and disinformation. And I really would like, for the participants to really be wary of that and really make sure that you're reliant on reliable websites when you're looking on COVID information. So during this presentation today, I mentioned American College of Rheumatology. I mentioned Illinois Department of Public Health. I mentioned the Centers for Disease Control to please obtain information on reliable sources because the disinformation is going to really lead you into really looking into resources that may not be reliable. And particularly if you have lupus, where care needs to be very specifically taken into consideration. It does not really necessarily help make the best informed decision. So it really is best that individuals go to those websites, go to those sources of information, talk to their provider, with that specific information. Obviously, every single patient is going to be distinct. So since I'm not a physician, I have a degree in public health and not in the clinical space, even though I've done years of work in clinical research in lupus, it's really important to have those conversations, but with accurate information in hand, because we've seen a lot of vaccine hesitancy in public health population, largely because of disinformation or misinformation. When the individual is provided the information, then they can make a clear and conscious decision about the risks and the benefits. And in the case of individuals with lupus, talk to their provider. So I think that really is an important take-home message at the end of the day.
Yeah. So yeah, if people have questions, clinical questions that aren't so much public health but are scientific, then they can forward them to me, and then we have access to a medical advisory board. We can forward those on to them. And then this presentation will be available on YouTube through our website. And I can also, I'll figure out a way to list the resources, the references that you've had. The CDC is great, and the Illinois Department of Public Health is great as well. But if there's ever a question about whether or not something is is reliable, you can contact us. And if we don't know, then we'll contact somebody who would. So thanks everybody. Karen, thank you so much for presenting. I know you're super busy, and I just really appreciate you taking the time out. I'm grateful to everybody who called in. Our next event hopefully will be live, fingers crossed, the Empowering Lupus Patient Educational Event on the south side of Chicago on April 23rd. Check out your mailbox for more information on that. You've presented at that, Karen.
Yes, I've presented at almost every single LSI event.
You've made the rounds. You've always been a great supporter of ours, and we're very grateful that you share your knowledge with us. All right, with that, I will say good night to everyone. Thank you so much. Any questions, contact me, Mary@lupusil.org, and look forward to seeing you all soon.